It's that time of the year again. The winter seems to be creeping in. Delhi's air quality has once again plunged into the danger zone, with pollution levels across key areas reaching poor to very poor categories. At Anand Vihar, for example, let's pull up those graphics for you. AQI hit a hazardous 366, while Dwarka Sector 88 Sector 8 actually recorded 326, both marked very poor, posing serious health risks as well to people. Central parts of the city, which we think are greener, no better. Major Dhyan Chand Stadium and Chandni Chowk saw AQI reading of 286, 276 respectively over there. Again, poor category there. The air quality in RK Puram and ITO, well, that's said to be the hub. A lot of traffic there as well. No better, remain to be in the poor category. And what's the story here? The story is that this is the state of affairs even before we have hit Diwali, even before we have started taking into account stubble burning from neighboring states. Imagine none of that has started and we are already in the poor to very poor category. And it's set to get worse. Why? Because remember, on Wednesday, the Supreme Court gave a green signal to green crackers. Experts have warned that after Diwali, the AQI is going to worsen, and sustained exposure to such toxic air can lead to breathing and health issues. So, what are we doing on the program today? We are discussing Delhi's perennial pollution problem. Is there a pollution ka solution available? And what is it that you and I can do as citizens to bring in some level of impact? Here on India Today on 5 Live, we are doing a doctor's roundtable to make sure that you are aware, to help you understand the problem of pollution, and also to understand, if you're not convinced so far, why you should care about pollution. I'm very happy to have an expert panel joining me now, and it is spread across categories to really give us a full 360 view. We have with us Dr. Nihar Parekh. He's a pediatrician, director of Cheers Child Care. So it'll be very lovely to understand what pollution is doing to kids. Then we have Dr. Vivek Nangia. He's a pulmonologist. What is pollution doing to our hearts? We have Dr. Sushil Dhar. He's the director at rheumatology at Fortis Hospital in Noida. There is a recent study that has said that pollution is actually linked to arthritis as well, which is what I want to really get into and understand from him. And then we have Dr. Balbir Singh. He is the chair and head of cardiology, Max Healthcare. He's a Padma Shri awardee as well, to tell you how pollution impacts your heart. Let me give the first word to Dr. Balbir Singh. Dr. Balbir Singh, we've been tracking air pollution year after year. For me, the change that has come in has been the fact that though we are more aware, we don't seem to be seeing more sort of solutions. There is no pollution ka solution on the ground just yet. The baseline pollution level is what I'm talking about. Because overall, we see farm fires go down. We see farmers finally being aided with the right solutions. But how exactly is it that even this very poor category of pollution level and this AQI is doing to us? Let me take that question to Dr. Vivek Nangia first then. Dr. Nangia, we've seen you write report after report. We've seen doctors talk about how lungs of even young kids are turning black. But there are still some who feel that air pollution is not the problem, that our body will adapt in some way, some weird explanation that I keep hearing from people. What is the clinical advice that you are giving your patients?
So, Sonal, basically, first we need to understand that what all harms can air pollution do to our lungs, and not just the lungs, but the entire health of the entire human body. You know, the effect is not just restricted to the lungs. When you have a larger particulate matter, like 10 microns and all, 10 microns and above, that usually gets filtered at the nasal level itself, and all it can cause is some kind of an burning in the eyes, irritation, nasal congestion. A particle size between 5 to 10 would get stopped in the upper airways. So there it would usually cause cough, irritation. But a particle size less than 2.5 microns goes right into the lungs, triggers off an inflammatory cascade, which then impacts the entire body. That includes the brain, the heart, kidneys, liver, all organs of the body. And in fact, even predisposed to certain hematological cancers as well. So if we enumerate the various systems and the various diseases it can cause, starting from the brain, it can cause brain strokes, brain attacks, heart strokes, heart attacks. Similarly, asthma, chronic obstructive pulmonary diseases, hypersensitivity pneumonitis, lung cancer. Lung cancer is becoming increasingly common in the younger non-smokers. Conventionally it was considered to be a cancer of the smokers, but now as we see in non-smokers, it is more common, probably because of the air pollution around us only. And this impact is
Right.
also in pregnant ladies, especially when they're carrying a child in the womb. The child itself, even before even before being born, can be impacted with a slow development of the lungs, poor immune system, intrauterine growth retardation, and so many other complications. And as the child starts to grow, they start developing allergies, more frequent respiratory tract infections, and in fact, some pollutants can even result in mental retardation in the children. So the impact of air pollution is far and wide. If you see, there are studies which have actually shown that our lifespans have gone down by anything between 2 to 12 years. The average expected lifespans in people who are being exposed to this kind of an air pollution.
Right.
So I guess,
Dr. Nangia, you talked about kids, which brings me to Dr. Nihar Parekh there, and I want to understand this. Dr. Parekh, we've spoken, like I said, year after year about how many kids are actually coming in with faults, or how many of them are coming in with, their body parts not functioning properly, and everything in some form or the other related to environment, related to pollution. I want a very specific answer to how much level of pollution starts impacting you immediately. Because, while we are showing the Delhi numbers right now, Bombay is no better. Mumbai, Bangalore, any metro is not better. In fact, I would go ahead to say that even tier 2 cities now, places like Kanpur and Lucknow are also getting worse because there seems to be no understanding of this problem in the first place. So at what level of AQI would you say now it's dangerous? Pack your bags and probably take a pollucation.
I mean, it's a round the year phenomena, especially, but during the winters, you will have to have a vacation for more than 3 to 6 months because this is not going to get better. It gets worse year after year, year after year. The minute there is smog in the air, above AQI going above 140, 150, it is directly proportional to the kids walking into our clinic, the number of nebulizers prescribed, the number of inhalers started, the number of antibiotics for an infective cough, secondary to an allergic cough, is just exponentially and we see it the next day. The minute we see the clear skies turning into gray skies, the minute we look out of our work windows and we can't see buildings down the road, we know next day is going to be loaded with this. And this doesn't get better. As the winter sets in, as the firecrackers are, they set ablaze, and those in the north you have the crops being burnt, is just going to get worse. I have not seen clear blue skies for winter, at least in the last 3 to 4 years. COVID was probably the last time we had brilliant
Yes, I was
AQI.
just going to point out,
After that, I don't think it's going to get better. So
Dr.
the
Balbir
minute you hear
Singh.
100 plus,
Yeah, let me bring in Dr. Balbir Singh. Dr. Singh, there are still those who are not convinced. There are still those who are going to the Supreme Court to say, allow crackers, make it green. There are still those who are saying, ab to ye har saal hi hota hai. They've given up. They're saying, we can't sanitize every place. How long will we keep our kids inside the houses, not send them to school? To those people, do you have an argument? Do you have a way to explain why we should care about pollution? Why should we be very, very worried?
So I'm a cardiologist, so I can tell you that we always think pollution affecting the lungs. What we forget is that the commonest cause of death due to pollution is heart, not the lung. And why does pollution cause death? Because sets up an inflammatory reaction by those small particles that can come into the lungs. They set up an inflammation. Body says, I'm struggling to fight against a small particle which is not mine, so it has a cascade. It attacks that with inflammation. That inflammation hits the vessels which supply blood to the heart. This leads to heart attacks. So this is something very silent, and people won't understand how pollution is causing a heart attack, because it is very simple to understand that it goes to the lung, so you need bronchospasm. So they think nebulizer is a solution, but what they don't understand is that it is reducing their lifespan. It is reducing mortality, and heart is a silent killer. It can cause a severe heart attack, and we know the London pollution, the first one happened, the heart attacks rose tremendously, and there were more deaths due to heart attacks than to lung problems. So we have to understand that this heart problem is a silent problem, and pollutants add to the fire. So it is like smoking. So if we say that please don't smoke, we also say that there'll be less pollution. So how do we compare? So people have to understand that it is not just cough, it is just not nebulizer which is going to help you. It is an increased risk of heart attacks and brain strokes both.
Got it. Got it. You know, I'm not surprised that you're saying it. We all know internally the story and how it is connected to air pollution. What really baffles me is that there are so many who are still not convinced. Which brings me to Dr. Viplesh Dhar now. Dr. Dhar, you know, year after year, as the air pollution problem is escalating, we are truly now understanding the extent to which it can go and the extent to which it can cause a problem as well. So you did a study very recently that linked air pollution to arthritis. Please take a moment to explain to our viewers how exactly is air pollution linked to arthritis.
Thank you for having me here at India Today. So at outset, I'll put few facts which are known to us about arthritis. It affects young population, mostly women, and in the best age group, that is between 20 to 40. So there is a genetic and a hormonal link known to us. There was already a study available to us which says that smoking increases arthritis. So Western population where ladies did have much more smoking, there was a higher incidence of rheumatoid arthritis. So what was in India which was not linked to smoking? So that was a study which highlighted the particulate matter of 2.5. PM 2.5 was the component which was linked to our study, which highlights that pollution aggravates your arthritis. So we know we have a gene and a hormonal stress factor which contributes to arthritis. But what was a catalyst or what was triggering it was the particulate matter in our society, in our population, in our country. Now, what happens when you take this study and go to the rural area? You will find a stark difference. People who were in and around the main arterial roads of our larger cities had the worst type of arthritis compared to the rural areas. So even if I have a gene and I'm in the same vulnerable population, but I'm away from pollution, I have a lesser amount of arthritis. Let us do the other way around. If I say that there is a power plant, say Dadri, so what is the incidence of arthritis in and around Dadri versus if I go to a hinterland where the same population is supposedly there, surviving there or living there. They actually have a lesser. So that exactly means that what we knew, how smoking affects us in terms of autoimmune disease, is similar how the pollution affects us, our immune system. It creates a havoc in our immune system, leading to increased incidence of arthritis. And that requires a course correction. And that requires awareness about pollution and linked to arthritis.
All right, you've heard opening comments, viewers, from all the doctors, and all of them agree and tell you that it's a problem. All of them are saying the same thing, that we are not even understanding how not just bringing down your quality of life, it's actually leading to disasters in some place. So the question is really simple then. Dr. Nangia, then how are we to deal with this? What was your reaction to green crackers, for example, being allowed by the Supreme Court?
Okay, so green crackers have been shown to reduce the emission by about 25 to 30%. But we still need to remember that there is still some emission that is happening, you know, especially firecrackers like Phuljhadi, Anar, Ladi, Samp, you know, they all, and the Charkhi, they all emit almost 200 to 2000 times higher particulate matter that has ever been allowed by the WHO limits. So that is the limit, and then if it is a reduction by 25-30%, how much are we really going to benefit from it? And let's not forget that it is not just the higher concentration, but just an exposure to the air pollution for somebody who's vulnerable. And when I say vulnerable, it actually means that children less than 5 years of age, elderly more than 60 years of age, and those who have any kind of comorbidity like a heart disease, lung disease, kidney disease, any kind of immunocompromised state, they would all be prone to developing complications because of the air pollution, even if there's a 25-30% reduction. But yeah, again, you feel that, okay, something is better than nothing. At least we still have some degree of reduction in the air pollution levels with the use of green crackers. But not that they would be 100% and 100% not being effective on our lungs.
Yeah. Dr. Balbir Singh, I mean, all of you in this question, please take it up, whoever wants to as well. Dr. Balbir Singh, you have such high-profile patients. You have politicians and celebrities come to you. This is one problem which is an equalizer. It impacts everybody. The beggar on the road to the one who is driving an Audi or a Porsche, right? It impacts everyone. Why is it that we have failed to take it up as a campaign? Why is it that our politicians are just not realizing the issue just yet? They are going to the court to say, allow it, it's tradition.
So I would think that they have not understood the problem well enough. They think pollution causes some cough or some visibility problems, nothing beyond that. They have not understood that it can lead to serious impacts on the vascular system and decrease the longevity. Over a period of time, pollution every year is going to reduce the number of years that we live in. It is going to increase the number of heart attacks. Now, this has not been understood well by these politicians or these high people. And they feel pollution is just cough and a nebulizer may help or putting a mask may help, which it doesn't. And that is the major concern that this has not impacted. So, problem like stub burning should have been tackled much well in time. It's not that they cannot be tackled. They should be tackled with a tough hand. Only then they will happen. As a doctor sitting here, I can just reiterate that the problems of pollution are many. I can just suggest to them that it is time that we all work together and get this problem, or a solution to this problem, where there are many solutions which they are best at finding.
Well, talking about it, I think there has been some substantial work. There has been some work done in Punjab and Haryana on stubble burning. This year, anyways, because of the floods, we will not see perhaps so many farm fires happen as well. But what we are looking at is a baseline pollution in the metros, which seems to be up all year round, only to be getting to an unlivable condition during the winters. But Dr. Parekh, Dr. Balbir Singh mentioned a very interesting bit about wearing a mask, etc. When it comes to kids, you can't even do that. Kids below 3, correct me if I'm wrong, can't even wear a mask. So what are we to do? When I go to my pediatrician, he'll tell me, Delhi is no place to live, pack your bags, go to the hills. When I was dressing up for this show, my makeup person just told me कि मैम अगले हफ्ते से मैं नहीं रहूँगा, मुझे asthma है, मुझे डॉक्टर ने बोला है, city छोड़ के जाना है. That's the reality of our times.
Yeah, so the thing is, it's so true and it's so unfortunate that we see our children grow up like this. We see kids right from the day they're born, right in front of us, go through this entire rigmarole of getting coughs, nebulizer, irrespective of the father or being an asthmatic, yes or no. Initially, genetics used to play a role. That if father and mother are asthmatic, chances of the child requiring nebulizers, frequent line inhalers later were higher. But that's not the case anymore. It's the air quality that determines their respiratory growth, frequent medications, nebulizers, like you rightly said, no masks under 2 and 3 years of age. So they just have to go. So the only thing you can do, and the take-home message for the parents is try and at least improve the air quality at home. I have a lot of parents who say, what is the advantage, even when they step out? But even at least some part of the day, 40 to 50% of the child's day is spent at home, maybe more, but definitely not less. So trying to improve the quality of air at home itself is a start. Getting a good air purifier, maybe getting rid of dust collectors, especially in the room they're sleeping in, like for example, rolling up the carpets, locking up the soft toys, getting rid of bird feeders in and around the house, which are known to contribute, sunning the mattress, getting dust mite resistant mattress covers, duvet covers. So these are things that you can do as a parent to at least try and help a little, as long as the child is inside the house.
But how long can you keep your kid inside the house? And it's not just the kids, your own health as well. Dr. Dhar is just smiling at that one as we continue to bring out pictures and the statistics of how Delhi's air goes immediately poor after Diwali. And as one of you also pointed out, except for COVID, when there was no vehicular pollution because everybody was home, working from home, our roads were actually freer, that was the only time we could breathe. Dr. Dhar?
I have a few words and a comment. It is you who is most responsible to take up the cause, champion the cause, and spread the awareness. The citizens also require their voice, and the voice should be a collective voice. The politicians also form the part of the society. The high profile are also the part of the society. They can afford air filters, they can have air purifiers, they can have the best living conditions, not the poor persons. So let's have a resolve where we put up or highlight this point. It is not only a health disaster. When we say that we live 5 or 10 years less than comparable with the same genetic makeup in other part of India, it shows a poor, quality of life when we have to live in a very stressful condition, health-wise and environment-wise. So it is not a good place to be in metropolitan anymore. People have come from distant places to make a living, but they will slowly leave this place if they continue to have a poor quality. I don't want to see my son suffering because of a poor quality of air or pollution. So I may go back to my smaller towns from where we came. So this is something where the reverse brain drain sort of a thing will happen for the metropolitans. So resolve not only at the time of Deepavali, it should be around the year resolve about
absolutely.
our pollution.
Yeah,
that's the only
Dr.
way.
Dhar, you're right. You're right that citizens should take up the cause. You're right about everything else as well. But this is not a problem which can have a private solution.
No way.
Dr. Balbir Singh, please correct me if I'm wrong. This is not a problem which can be solved by putting air purifiers or wearing a mask or staying in a sanitized area and saying that, okay, I am protected. I will live in a bubble and that is about it. This is a problem that needs a public solution. And we've been asking for it year after year. The point is, it's only this time of the year when it gets out of hand that we really get to question it. But frankly, if I were to look at AQI levels and I track it throughout the year, even around March, even about a month ago, it was still about 150, 200. The haze hasn't left us. It's just that we are so used to seeing absolutely bad that we've become okay with something which should not be there as well. Dr. Singh.
Yeah, so I fully agree with you. As a citizen, what do? I can't be putting the mask the whole day. I can't be sitting in my room with the air purifier the whole day. I have to go out. I have to go on the roads. These are no solutions. Solution has to come as a big campaign which has to involve the politicians and other people who can build a program to reduce the pollution rates. And there are many solutions. There's not one solution. There are many solutions. Many cities in the world around have done those solutions effectively. Many cities in China, Japan have done it effectively. And so can we. But we need to understand that it is just not cough, which is the problem with pollution. Because if people think it's a small problem, it is not like COVID that we have to strike hard, then they are wrong. So that has to be understood by them that this is not a small problem. This is a big problem, and we have to tackle it with a strong hand.
Pollution is a slow killer. I think people don't understand that. It's not like you're going to have a stroke today because of pollution, but your stroke could be linked to pollution. I was interacting with a bunch of doctors who treat in cancer, and she said that I have 5 categories of high risk. Number 1 is genes. Number 2 is air pollution. I was shocked. She said people who stay in most polluted areas all year round, not just this time of the year where you can possibly escape if you're privileged enough to do that, are showing higher risk of cancer as well. So this is a very serious problem. But Dr. Nangia, as you and I have been speaking for years now on this issue, we have put out billboards of lungs turning from pink to black. We have shown pictures on Instagram saying this is what your lungs look like. We have spoken about it at every forum possible, but yet we are here. So I ask you, do you think what is it that we are not doing? What is lacking that there is still no solution for pollution? What is it that we are still doing that nobody seems to be waking up, when I can tell you all our politicians are as impacted by it as anybody else, as that traffic cop on the street or the street vendor who's trying to earn his daily wage. Everybody it impacts equally.
See, I think the solution to this is much more complex than we actually think. One, of course, is the political will, and the other also is that something that we ourselves can do. What we completely forget at times is that there are certain measures that we can take, like avoid moving outside when it is not necessary, especially when the AQI levels are so high. I think time has come where we need to decide our outdoor activities based on the AQI levels. So when AQI is more than 400, then nobody should be actually moving out or moving out only for essential work and not more than that. When the AQI level is more than 300, then one should be avoiding any kind of strenuous physical activities like exercising outdoors or all these the marathons and the games, sports activities. So all that should be avoided outdoors. And when AQI is more than 200, then for all those who are vulnerable, those who fall into the vulnerable category, as I mentioned earlier, they should be avoiding any kind of strenuous physical activity outdoors. So those are certain measures that we need to be taking. I think we need to be relying more on carpools now, because a lot of smoke and a lot of smog that is created is also because of the the traffic congestion,
Vehicles, yeah.
vehicular congestion outside. So I think that is something that we need to be taking. Planting more green trees around us is very, very important. We should be making use of public transports, especially metros. In Delhi, you have such a good metro network. I think we should be using more of that. Avoid smoking ourselves. There are still people who are continuing to smoke and they consider it a joke. That how does it matter that, if I'm smoking, because in any case, I'm exposed to the poor air quality outside. So that is something that we need to understand, that we're doubly harming ourselves. It's like a double whammy kind of a situation where already you're exposed to the air pollution. On top of that, you're smoking as well. In 2019, almost 1.6 or 1.7 million deaths in India alone were attributable to air pollution. Every year when the AQI levels increase, there's a definite increase in the number of patients getting admitted to the hospital with not just asthma, chronic obstructive pulmonary disease attacks, but also with acute heart attacks. So that is the situation that we're facing. And I think it's important that we realize ourselves, and not just the outdoor air pollution, but there's a lot one can do for the indoor air pollution also, because 80% of our time is spent indoors. If you actually see that you're in the office, in the malls, in schools, hospitals, wherever you are, they're all indoor situations where the air quality is still in your control. But we tend to forget all that. Indoor air quality.
But let's talk about what we can do, because we can keep debating till the cows come home on what is a solution and keep waiting for the government to bring it in. But I want to open it up to all our doctors on this roundtable today. We'll start with you, Dr. Nangia. What is it that you do to ensure that you and your family are better off as compared to, when the pollution gets really bad? What is it that you are doing?
So, of course, we reduce our outdoor activity to as minimum as possible. We would probably combine 2 or 3 of us would go together in the car if we're going in the same direction, and try and avoid going in separate cars, even if it is a gap of say half an hour, 30 minutes, 45 minutes gap. You try and club together so that the vehicular load on the roads is also down. Wear a mask. N95 mask is something that can provide you protection to the PM 2.5 particle and less, but unfortunately, it doesn't provide you protection against the toxic gases. And another word that I want to give off to all the audience here is that people who are already suffering with their diseases like diabetes, hypertension, asthma, COPD, they must keep it under check with regular maintenance therapies. Whether the asthma patient, they should be on regular inhalers, nebulizers, or whatever they're taking, but they should be in touch with their doctors, keeping their illnesses under complete maintenance.
Right. Dr. Balbir Singh, since you are the only one here with the mask on you, let me ask you, what is it that you are doing to ensure that you and your family do the right thing this pollution season?
So what I can suggest is exercise at home. because exercise is an important part of life. So the very fact that you can't go out shouldn't stop you from exercising at home.
Yep.
Drink a lot of water. The water reduces inflammation. Treat your diabetes and cholesterol levels very well, because cholesterol adds fire to this inflammation. So a high cholesterol is the worst enemy with this. And smoking and alcohol both have to be avoided at all costs. So simple things. And if you see somebody burning leaves on the road or in your colony, take strict actions to show that.
Right. Right. Well, in Diwali season, you're asking people to keep control, you're asking people to not eat and indulge, and you're asking people to ensure that they exercise at home. I don't know how much of that is actually going to go down. Dr. Dhar is with us. Dr. Dhar, your recommendation, and what is it that you do personally?
I have a very simple solution for everyone. Let us talk about pollution for around 365 days in this country. We cannot have a solution just for a purpose. Why do we allow the AQI to go bad? There are enough and more cars in, say, anywhere in America per head. So one person has 1 or 2 cars, but their air quality is never so poor. So why have we allowed this to happen? Why our roads are not paved the way it should be paved? So it's just not vehicular pollution. We have allowed ourselves to degenerate to a level where we have to, call a meeting, for a few days to, sensitize people about pollution. Pollution is a 35-day issue rather than a few weeks or few months. We are going to have a very terrible winters, we all know. But we did not make any changes in our day-to-day lifestyle. We have never asked our government and governance to deliver what is deliverable. It is not asking, we are asking basic things. And how, as an educated person in society, we have not put our point across. So meek in out. This is our genuine, it affects each one of us. And it does affect in the worst possible manner. It increases the cost of living. If I get an MI, 5 lakh rupees is lost. So it is cost burden. So as an economist, if I think just not like a doctor, I would see it's a huge loss to this country. And the effects are very simple and are all doable, which we do not want to do. And we just want to shun off by not asking what is doable from the government, from the governance as well.
No, I think since I asked all of you, let me tell you what is my sort of pollution toolkit in a way. My first thing is to get the air purifiers up the minute we hit September. Air purifiers up in my kids' room, in my house, in my bedroom, and especially at night, because that's when your breathing thing is up. To ensure that you're wearing your N95 mask. The takeaway that I'm taking from Dr. Singh is that also hydrate, ensure that you're having enough water. But since I have all of you, a lot of, on Instagram, since everybody's a doctor, it seems, I want to understand, do these drinks that trend sometimes, that this will bring down pollution in your lungs and this will cleanse your lungs, it will clean away your lungs, does that work, Dr. Nangia? Is there a magical way in which the lungs can be cleansed out of air pollution? Do any of these drinks work?
Truly, if you ask me, in one word, none. None of the drinks, none of the methods, whether it's inhaling pure oxygen or whether it's some kind of a salt therapy that came up a few years back, none of these therapies can actually work in improving your lung functions other than good exercise, whether it's yoga, pranayam, deep breathing exercises, using what is called incentive spirometry. You could do that. Certain kind of yoga exercises like Alom Vilom, Kapal Bharti, they all improve lung functions. Yet they won't protect you from the harms of air pollution. They would only improve your lung capacity and your breathing pattern. Yes.
Got it. And Dr. Singh, then, if I can ask you, this is also the season where a lot of people are eating a lot of dry fruits. Our calorie intake is generally higher. We don't want to dampen everybody's spirit and say that don't have anything, this is the worst time, stay indoors, don't meet people, don't eat food, don't follow any traditions. We are just saying no to everyone. Is there a way in which we can tell them to indulge in the right form?
Right. So the food doesn't mean that one has to eat unhealthy food to say that this is the taste developed can be for good quality food which can provide the same kind of structure, same kind of happiness. So, but indulging in smoking at this time, whether it is Diwali or no Diwali, should never be the aim. One should forget that and never aim at smoking or drinking. WHO has made drinking as zero to prevent the cancer, and we should stick to these norms, whether it is Diwali or not. There are many methods to celebrate Diwali, not by just smoking and drinking.
All right, so there you go. You have heard it from the doctors, not from Instagram fake profiles or anonymous AI videos. You've heard it from country's best doctors today on this round table on what pollution is doing to your lungs, to your heart, to your knees. It's basically not just choking your throat and your nose or your lungs even, it's choking away your entire lifespan. And that's what you need to look at. That is why it is important to find a solution for pollution. We don't have it yet, but we only hope that the tips that we've shared will help you at least take care and ensure there are no emergencies that emerge just yet. And of course, the big takeaway here is the fact that we need to be tracking this problem all year round.